Hello and welcome to Chapter 8. We will be finishing up now with Medicare physician and other health professional payment system. So this is our last chapter on the last prospective payment system, which is physician. Okay, so we will talk about all of these things in our PowerPoint today. Okay, so reimbursement for physicians physicians and other qualified healthcare professionals under Part B. Some of the services that would be included under this professional physician payment system, professional payment system, is office visits, diagnostic procedures, surgical procedures, and therapies. The settings that this care would be provided would be in a physician office, an ASC. It can be done by a physician, any type of physician visits within a hospital, inpatient and outpatient, any physician visits or other healthcare professionals in a skilled nursing facility. And the providers that are covered under this system are physicians, chiropractors, nutritionists, physician assistants, nurse practitioners, occupational therapists, any type of healthcare provider. Okay, there are two parts to this PPS. First, we have the Resource-Based Relative Value Scale, RBRVS. This is a resource measurement system that assigns values to services based on the cost of furnishing services in different settings, the skill and training levels required to perform the service, and the time and risk involved. Okay, so just like in Chapter 5 and 7, this PPS uses the relative value unit as well, the RVU, as the unit of measure. Okay, then we have the Medicare physician fee schedule. This is the maximum amount Medicare will pay for a service. So this fee schedule amount is determined by multiplying the RVU by the conversion factor. Okay, so payments in the Medicare physician fee schedule are based on three components. First, we have the relative value unit. Then we have the GPCI, which is the Geographic Practice Cost Index. And then lastly, we have the conversion factor, which is CF. Okay, so the RVU is assigned to each CPT code or HCPCS code, and that is the measure of resource utilization. There are three RVU categories. The GPCI is an adjustment for geographical differences in cost. So think of like providing care to a patient in downtown Chicago versus providing care to a patient in, let's say, Southern Illinois. Definitely a difference in the cost of treatment. Each RVU category has a corresponding GPCI. And then the conversion factor is the dollar multiplier that sets the reimbursement rate. Okay, so within the RVU is composed of three things. Okay, so very important to know this, that RVU takes into account the work, the practice expense, and malpractice insurance for a physician. So the first thing, work, is the time required and the intensity of the procedure. So it is the mental effort and judgment of the physician or healthcare provider. Technical skill, physical effort, psychological stress. Practice expense is the overhead costs of the practice. This is payroll, office expenses, supplies and material costs, medical equipment costs. There can be two practice expense components, the facility, which is the hospital, and the non-facility, which is the physician office. Okay, so if you take a look at Table 8.1 in your text, you'll see some examples. Lastly, malpractice is the cost of insurance premiums for the physician. So it includes professional liability insurance, and then CMS collects data from insurance carriers to set the malpractice RVUs. So all three of these things are taken into account when determining the RVU for each procedure. Okay, so the GPCI, the Geographic Practice Cost Indexes, are based on locality or payment areas. So usually they'll lump large metropolitan areas in one locality, and then the more rural parts of the state in a different locality. Sometimes it can just be the entire state if the cost of providing care is the same in that state, regardless of location. Okay, there is one GPCI for each RVU category. Okay, so there is work GPCI, practice expense GPCI, and malpractice expense GPCI. So all of that is adjusted based on where the physician practices. The conversion factor is set prior to the start of the rate year and remains constant throughout the year. The conversion factor is Medicare's direct control on Medicare payments, and it is updated annually and published in the Federal Register. Okay, this is the complex calculation for the Medicare physician fee schedule. First, we have RVU work times GPCI work plus RVU practice expense times GPCI practice expense plus RVU malpractice times GPCI malpractice times the conversion factor. That leads you to the payment amount you will see in the Medicare physician fee schedule. Luckily, the Medicare physician fee schedule, which I will show you in a little bit, shows you this amount based on locality. So you don't really ever have to worry about calculating this. This is already calculated and then posted on Medicare's physician fee schedule. Third-party payers utilize RBRBS for reimbursement and modify the system to fit their own needs by modifying the conversion factor. Okay, so third-party payers typically use Medicare's physician fee schedule. However, commercial payers often pay more than Medicare, so they will just increase the conversion factor. So they utilize Medicare's physician fee schedule, but alter it on the commercial side. Okay, I am going to show you this fee schedule. Okay, so if you click on that link, also another way to look it up is you literally could just type into Google Medicare's physician fee schedule and it'll take you there. Okay, so the first thing you have to do is click begin search. Okay, this is important that you understand how to use this because your homework exercises include looking up fee schedule amounts. Okay, so you'll see here it's the physician fee schedule. We're looking at year 2022. You can go back and look historically what the rates were, or if you're working on a claim from a previous year. Okay, type of information we're looking for right now is pricing information, but note in the drop-down you could also see payment policy indicators, relative value units, or the GPCI. Right now we're just looking for the full pricing information. Okay, you'll keep all modifiers the same. And you can either select in your homework all max or the national payment amount. Okay, so we're just doing the national payment amount. However, if you're working for a certain practice, you would actually look under the specific locality because it will be adjusted with the geographic. The GPCI would be adjusted in there. But for purposes of homework, we're just doing the national payment amount or all max. Okay, so let's say we're looking just at a level 4 established patient visit and we want to see what the payment would be. Okay, so we'll search the fees and then you'll see your search results here. Okay, so here it shows you the non-facility price. So that's in an office, physician office. That's typically where it happens. If they're seeing the patient in the hospital, then it's changed lower. You'll also see like you have a status code here. MAC locality should be 0000 because we didn't specify a specific location. This is just the national payment amount. Okay, so that is how you look up a specific code and what the pricing would be. Just to show you a couple more things you could do with this. Let's say you're looking for like a global period. You could select global here and then I'm going to put in a different code. Let's see, 33533. I think that's a cabbage. Hopefully that comes up right. Oh, let's see if it actually shows up. Oh, it didn't show up the way I wanted it to. Let's see. Well, it showed the price. So this is for a cabbage, and then it shows how much it would be paid for. And notice that it only shows the facility price. Why? You can't do a cabbage in the office, so it's not applicable. So it shows you that. You could see here kind of like the conversion factor that's being used. So a lot of different information you can see here. Okay, so if you want to see the global period, I think I'd have to change this to payment policy indicators, then global. Let's see what we find now. There you go. So if you wanted to find out what the global days are for a procedure, which we've talked about before, all the services included within that time, you would select payment policy indicators, then global, and this will also show you, what the global days are. So a cabbage is a 90-day global period, and then it shows you if you can bill multiple surgeons, if you could do it bilateral. For purposes of your homework, though, you're just going to select pricing information and national payment amount, and the modifier will just be all modifiers, and that's where you will find the fees. All right, back to our PowerPoint. Oops, wrong one. Okay. All right, so when we talk about Medicare physician and other professional payment provisions, we have participating providers, non-participating providers. I will show you in a moment how that works. Okay, a couple other things. If it's a bilateral procedure, typically they will pay 100% of the first side and then 50% of the other side. So the total reimbursement would be 150% of the MPFS, Medicare Physician Fee Schedule. Multiple procedures, they pay 100% on the first procedure, and then the second through fifth procedure would be 50%. If there's 6 or more procedures, that would be an independent review. If there is an assistant surgeon that is helping the physician, they would get paid 16% of the Medicare Physician Fee Schedule. Okay, so there's a couple different adjustments that can happen in the Medicare Physician Fee Schedule. If it's an underserved area or a health professional shortage area, they would receive a 10% increase in payments. All right, par versus non-par. So participating providers means that they are enrolled in Medicare and participate by accepting Medicare assignment. Non-par means the opposite. They are enrolled in Medicare, but they are not participating, so they do not accept assignment. Accepting assignment means the doctor, provider, or supplier agrees to accept the Medicare approved amount as full payment for covered services. Okay, so a participating provider agrees to accept assignment of claims for all services. That means they will always accept the Medicare allowed amount as payment in full, and they will not collect more money from the beneficiary. However, a non-par provider, they receive a lower reimbursement amount of 95% of the allowed amount. And what the difference is, they can bill beneficiaries up to the limiting charge, which is 115%. So reimbursement is sent to the beneficiary, and then they have to pay the provider directly. So here's an example. I'm not going to go through all these. You can feel free to pause this at this point. It shows how the calculations differ for a par versus non-par provider. So feel free to pause this, maybe print it, screenshot it, make sure you understand how this reimbursement works. All right, so we also have a quality payment program in the Medicare Physician Fee Schedule. So it is mandated by MACRA, which is Medicare Access and CHIP Reauthorization Act. It links physician payment to quality measures and cost-saving goals. There's 2 tracks, the MIPS and the APMs, Merit-Based Incentive Payment System and Advanced Alternative Payment Models. Okay, so when it comes to MIPS, this consolidates the Medicare Meaningful Use Initiative. Physicians can receive bonuses based on performance on metrics. So typically there's a 4% reduction applied in 2019 if the physician failed to participate, and the incentive and penalty percentage increases each year until it reaches 9% this year. Lastly, the APM model. This has a significant risk for providers and offers a potential for significant reward. So it's 2-sided. There's a care improvement advanced model and comprehensive care for joint replacement payment model. And reimbursement is a blend of traditional MPFS and per beneficiary per month. All right, that is Chapter 8, Medicare Physician Prospective Payment System in a nutshell. Hope this is helpful, and thank you.